understanding our life situations and then supplementing or doing protocols to sort of counteract the life we choose or don't choose to live is just how we get through this life healthy, which if you don't do those things, I really strongly believe those who don't are going to have a decreased lifespan. It just makes mechanistic sense to me. Like, how can you just go through all these things and not have one of these chronic diseases come up and shorten your life if you're not proactive about it?
You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, I have a treat for you. I brought on Kyal Van Der Leest. I brought him back on. We had him on earlier this year. You guys loved him. He is the formulator and developer of LVLUP Health. We are talking all things peptides and how you can support your GLP-1 journey along the way. There are so many factors to consider when you are utilizing GLP-1s, whether it's a microdose or a regular dose, whether you're using it for many of the reasons that I talk about with microdosing, or you're using it specifically for weight loss and type 2 diabetes. You got to support certain systems. And there's things you should know. We cover it in this episode. We talk about gut health. We talk about liver health. We talk about biliary health. We talk about hormones and thyroid. We talk about longevity and NAD. We talk about body composition and how it's not just about taking a GLP-1 to lose weight and you think you're going to get the body of your dreams. We talk about muscle preservation and muscle protection and so much more. Kyal and I love to nerd out, and the guy is a mad genius. So without further ado, let's jump in. Kyal Van Der Leest, welcome back to the Dr. Tyna Show. I'm so excited to have you here for round two. You were here earlier this year. We talked about peptides, and we're getting you back on the show today.
Yeah, thanks for having me back on, Dr. Tyna. It was such a good first episode. If anyone's not listened to that, go back in the archives and have a listen. It's still to date my favorite podcast I've ever done, and I'm not just saying that.
Aw. Well, I hope I live up to it today. No, that was so fun. I think it's because we're both naturopaths and we get it. Like, we have that thing, so it was really fun to be able to connect with you on that level. And I just think you're such a brilliant young man. And I love your product line. I love what you put out in the world. So this will be great. What I want to talk to you about today is, I got a lot of questions from part one, and it was mainly around what can we do to support our GLP-1 journey? And people really are interested in kind of what the adjunctive peptides look like. And you have such great formulations in your LVLUP Health line that I refer clients to very often, and patients. I wanted to just hit on a few of them and maybe go through, like, from our point of view, naturopathically, especially, everything being sort of gut health first, talking about some of the products that I think really stand out. And hopefully this will be helpful for people because they've been asking.
Yeah, well, I'm glad people are aware that they do need to have some sort of support when they're on GLP-1s. They're not a free pass. They're not something natural like a vitamin or a botanical where you're just going to get all the benefits and there's no risk for side effects or very low risk. There are quite common side effects that can occur with GLP-1 medications, as I'm sure your audience know. If you wanted to quickly discuss them, I can discuss them if you wanted to, but you're the GLP-1 microdose/macrodose expert, and you can let people know what they are and if they're on a GLP-1 on any dose, what they might expect or might want to look out for before we get into how to fix those things.
Yeah, for sure. So what I have noticed, even on a microdose, and first I want to say to everyone listening, if they haven't heard my content before, a microdose is not a standard dose. And so unfortunately, even folks who've taken my course, I have a course for practitioners that is very comprehensive, but even the doctors who've taken that, I've seen their content online, and they are advertising, as are most of the telemedicine companies, as are most of the doctors out there, they are advertising a microdose, and what they're giving is a standard starting dose. And unfortunately, I've got a lot of followers and I talk to them. I have inquired with some of them who've come to me having horrific side effects. And they say, I've lost 30 pounds, but I'm having all these side effects. And I say, first of all, if you've lost 30 pounds, you're not microdosing, because a microdose is not a weight loss strategy at all. It's more for, I propose it much more for an immunomodulatory effect, neurocognitive benefits, cardiovascular benefits. It is not a weight loss strategy. Some people do lose weight on a tiny little dose, but those people are usually really metabolically optimized already. So that said, the companies, what I found out, Kyal, that get this, what a lot of these companies are advertising is they're telling the patients, and I know this because I've heard it from at least 3 dozen people in my following so far. They're telling the patients that they're being given a microdose when they're really just being given the standard starting dose or maybe even a level up from there. But what they sell them in on is they say, well, the dose of, like, let's say semaglutide, the dose of semaglutide is 2.4 milligrams. That's the highest dose you can get. The very highest dose. And they say, because we're giving you a fraction of that, which is what I propose is a fraction of the standard starting dose, because we're giving you a fraction of that, it's a microdose. And so these people are being given sometimes first, second, third tier up dosing, losing a ton of weight, losing a bunch of hair, losing a bunch of muscle, and they don't understand what's going on. And it's all because they're just standard dosing. And when I explain this to them, they get very upset because they're essentially being lied to and misled. So that's a problem. And I say that because you're going to run into some of these side effects that I want to discuss today. Number one, we have data showing, and recent studies, and I've seen this even with true microdoses, SIBO setting in, which is small intestinal bacterial overgrowth. I've seen that set in. It's happened to me, even on a micro. I came in with a history of SIBO, though, and I will say that most of the patients I have tested have SIBO to some degree, or they come in with the symptoms of SIBO. So very common. Gut issues are very common. First thing I propose folks do is really heal up and stabilize their gut before they even touch GLP-1s, even if it's a microdose. Number two is wasting. Even if you're strength training, there is still this ramping up of AMPK, and it can lead to wasting in folks that are not consuming enough protein or not actually doing anything to mitigate or protect their muscle. I think if you come in with hormonal disruption, it really magnifies it. So for instance, I've had ladies with PCOS, even on a tiny little microdose, start having tremendous hair loss because it cranked up their androgens so high. I've had folks with hypothyroidism that's not being handled, and that's a big one. And because I think most women over 40 are hypothyroid to some degree, or could use some thyroid support, I should say. They end up with all kinds of thyroid symptoms, so that it really it can magnify those symptoms. So supporting sort of that system. And then I would say, people assuming that even if whatever dose they're taking of a GLP-1, they think that that's it for weight loss, but they don't realize they need body recomposition. They don't need just weight loss and appetite suppression from the GLP-1. They actually need to spark their metabolic health. And so there's other peptides out there and other substances that are helpful for that I usually suggest. So anyway, all that to say, those are the big ones. I know there's other ones, and I think I've covered those at length on other podcasts, but any of the things that we're going to discuss today, is there anything you want to add there too?
I just always look at GLP-1s in the same way I look at TRT, right? There's clever, intelligent dosages of TRT that can elicit really profound and beneficial effects for the individual. It's the same with the GLP-1s. You can cause as much damage with the GLP-1 as you can with exorbitant amounts of testosterone or any of the other hormones you're replacing. So these are a difficult and nuanced medicine, I'm going to call them that, to use the same way TRT is. But it definitely, with the right strategies, being aware of the side effects and the risks of using these things, they can be used very effectively and very powerfully. The first thing that's probably the easiest thing to talk about, because it's piggybacking a little bit off what we spoke about on our last podcast, is the rapid weight loss and the issues that can occur with that, because that's something. One of my friends was quite overweight, and we got him on, ketogenic diet. He lost a lot of weight really fast from that. But the liberation of toxins too fast can occur very, very easily with, not even mega doses, but within, your regular doctor's range of GLP-1 medication. So the easiest and probably, in my opinion, one of the most important things to do is support liver health and clearance of toxins when you're losing weight fast. So let's not even get into the nuance of what your dose is. If you're on these things and you are losing weight, be it from a GLP-1 or any weight loss journey, it's really important to make sure that if you've had a background of toxin exposure, heavy metals, mold, glyphosate, pesticides, that you're doing something to clear those first and foremost, because you do not want them redistributing in a fatty organ or another tissue in the body. And it goes from being rather benign and diluted in fat to something that can then cause organ dysfunction. So definitely binders would be useful to take around bedtime away from other supplements if you're losing weight fast. But let's get on to the most common one that you mentioned. It was first and foremost was the gastrointestinal problems that you have, the SIBO. Often you end up with issues with bile and fat digestion, and stomach acid can be affected, but not as often. The reason this happens, obviously, is the GLP-1s affect gastric motility. They slow it down. They keep you feeling full for longer, both in the brain and physically in the small intestine, the gut, and in your whole digestive tract. So this is good in a short term, but in the long term, how SIBO can occur is undigested food matter. It's common for people who follow a vegan diet to end up with SIBO because of stomach acid insufficiency. And with stomach acid insufficiency, you are relying on your bacterial populations to break down a lot of the food because your stomach and your stomach acid and the enzymes haven't done the job well enough that you need to rely on your bacteria to help you out with it a bit. It's a decent backup system, but not one that you really want to have because long term that can lead to these overgrowths. A similar thing happens with GLP-1s where the gastric emptying and the motility is so slow that the bacterial populations tend to increase, or you might get overgrowths in areas of the small intestine where you really shouldn't have it. And I believe that's because of how slow that motility can get. There might be some other factors in it too, but that's where I think we have a lot of really good naturopathic ingredients, not even touching on peptides yet. A lot of really good naturopathic ingredients and protocols for SIBO that if that does happen, you could turn to those. Look at some antibacterial herbs, some gentle ones. You don't want to go crazy with oregano oil or anything like that for a long term. But one that I use with great success is TUDCA, is the bile acid. It's going to help with, it thins your bile, it helps bile flow, and bile is a really good disinfectant for the small intestine. It dumps into the small intestines to help with fat absorption, but it's really good at clearing out bacterial overgrowths. And then as well, if you got a lot of fat in your diet, or even if you don't, and you're just on GLP-1s and you want to help your absorption of fats and the fat-soluble vitamins, then TUDCA is going to be fantastic, and probably the first port of call when we're looking at the gut from top to bottom would be right in that jejunum, the small intestine, the first part of it. Support that with TUDCA. The biggest point that you said that really was impactful is make sure your gut health is in check first. Obviously, the SIBO we just mentioned, but leaky gut as well is something that so many people, if you had to guess how many people in, let's say, America had leaky gut or some sort of low level of IBS or IBD, what would you guess that figure to be, Tina? I would say
everyone.
25, 40% of people have something that would be detectable on labs, or a fecal biome sample, or looking at calprotectin and zonulin, but it's pretty high. So supporting
I would say everyone. I would say anyone consuming American food and American grains, especially, are probably dealing with some kind of leaky gut, and then consequently leaky brain on top of it, right? If you have leaky gut, you've probably got leaky brain. So it's super common, and whether you test it or not, just going off symptoms, you can. If people are burping and belching and farting and having skin issues and having histamine issues, they've got leaky gut.
Yeah, it's pretty ubiquitous in America, Australia, all the places that have incredibly high industrial, agricultural pesticide use. Gluten gets a lot of the blame, and I don't doubt that it is a huge contributor, but I honestly think glyphosate and eating non-organic foods is the problem, because as we know, as you probably said in this podcast in a prior episode, if you go to Europe and you eat the gluten, you're not going to react the same way you do in America. There's no GMOs, or there might be no GMOs depending on the country, and they don't use an exorbitant amount of pesticides, if at all. Therefore, the food is something that isn't going to completely wreak havoc on your gut, on your intestinal flora, and you're not going to react to it as readily. If you're celiac nuance, maybe you'll still react because of the immune system activation from the gluten, no matter where it's from. But yeah, most people don't react in Europe and France and all these other countries. So gut health, leaky gut. All right, we want to make sure that we don't have intestinal hyperpermeability. On our last episode, we spoke a lot about gut health and the importance of that for whole body health. But the immune system's on the other side of our gut. So if we've got immune issues, autoimmunity, it's really important to focus on gut health to reduce our overall inflammatory burden. But from the perspective of GLP-1s, are you seeing a lot of people who are on them have like horrible digestion? The motility in and of itself is going to lead to SIBO and potentially lead to SIBO. Not always. There's nuance to everything we have to be considering. But do you see elevated markers for zonulin and calprotectin? And is that something that you're noticing in your patient set or from other practitioners reporting?
So what I hear about is all over the place because I have people reporting in from all over the world through my following as well. So I get a whole different, it's wild. I mean, it's not even just my patient base that I hear about. And I hear from other clinicians and I hear from students inside my course. And, I hear, because the course is for the general public and for practitioners. So I'm getting it from all over. I specifically only really discuss microdosing with people. And so when they come in and they say, oh, I'm taking this standard dose, I'm usually like, buddy, I can't help you because that's not my forte. I'll just say this, I would never dose somebody up super high on a GLP-1 ever. I don't think it's a great idea. I'll just put it out there. So and I do use it sometimes for weight loss, but I still am very conservative with it and I'm very careful and I still try to cycle it. So in those individuals, because I just really don't love people being on it for long term. I don't think there's any way around not getting SIBO, to be honest with you. I just don't think there's any way around that if you're on a high dose for a long time. That's just my opinion. But what I do hear about is people complaining of, they don't realize it's their gut. So histamine issues will show up. We're giving it to somebody to quell mast cell activation syndrome or to quell their mast cells. And because it sits on the it actually binds our immune cells. GLP-1 does. But then all of a sudden we get into this other ball, especially if they're doing HRT with some of these telemedicine companies or doctors who aren't really being super careful. And we've got women on doses of estrogen that are driving histamine issues. It's a whole mixed bag. And so I see kind of the car leave the freeway, if you will. Like the train kind of goes off the tracks and they start reporting symptoms that don't match up at all what should be happening if they're truly doing this in a conservative way. I guess I'll leave it at that. And so I'm not necessarily going after looking at, do they have markers of like, I don't get too nitty-gritty into testing with people when it comes to their gut, because I'm pretty quick at identifying gut issues and I treat the gut first anyway. So I'm going to treat them anyway. I'm going to use something like your Ultimate GI Repair, or I'm going to use the one without the BPC 157 in it, depending on what I'm trying to go for, because I just want to clean it up. And I am going to come in with some biofilm dissolvers, and I am going to come in with some herbs, and I'm going to cycle those too. And I have a whole way I do this. And so I'm very careful about it, but I will start to see symptoms that don't add up to what should be happening. Or we'll see labs come back where metabolically they start to actually decline. And I'm like, what's going on there? Because isn't it interesting? This is the totally ironic thing about this, you guys. SIBO will drive, it's not a direct cause, but it will drive insulin resistance and obesity. I think it is one of the root causes of insulin resistance and obesity, especially in this country, in the US. And yet we're giving people a peptide that, if not done appropriately, they could be driving the SIBO, which is driving the problem they're trying to treat with the peptide. Isn't it ironic, right? And so anyway, I do the TUDCA, I do the ox bile. I love that you have a TUDCA with an ox bile in it. I think that's brilliant because you're a brilliant naturopath. You got the two in there. We want to keep digestion going. That's why I say that exercise is non-negotiable, because we have to keep peristalsis going, and this is why I don't think people should be dosing this stuff by themselves. I don't think they should be getting it off random mamsy-pamsy off the internet and putting it in them. I don't think they should be, let me say this. I don't believe you can do HRT and peptides appropriately unless you take an integrative approach. I really don't. That's my firm opinion. I don't see how you could not. I don't see otherwise. Like, we have to address those issues, because people will stall, or they'll hit the wall, or they'll start getting really bad GI issues directly, symptoms. And I'm like, dude, we gotta pull you off the peptide. We gotta treat the SIBO. And SIBO never goes away. Leaky gut never truly goes away. You're just getting it down. You're dampening it down. And so I see how we could be getting into a big mess with these. This is why I've stepped back from talking about it, because people have taken my message and they've twisted it and bastardized it and said, oh, Dr. Tyna says GLP-1s are safe. And I'm like, no, 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 no. I never said the way you guys are doing it is, in my opinion, a great idea. I have said I have this way of doing it, and it's pretty complicated. So that's why it's behind a paywall on a course. Like I can't share it all on the internet. There's not any time, right? The whole podcast would be about that. So anyway, I do think supporting the gut, going in, understanding this, and then making sure that all of the things are addressed, and we can generally avoid the big pitfalls. That's my rant.
So just to summarize all of that from what I'm hearing is the GLP-1s cause the reduction in gastric motility, which then can lead to SIBO. And then the SIBO can lead to hyperpermeability and leaky gut. And then from that, you'll develop insulin resistance, and then you'll just have that rebound weight gain afterwards. You might get the benefits in the front end, but then long term, it'll all come back if you've got SIBO and leaky gut. So well done. You've taken medication, you've lost the weight, and then you're frustrated. Biggest loser effect, but with GLP-1s.
And on top of it, these people are not protecting their muscles. So I get these messages too, Kyal, that kill me. They say, Dr. Tyna, you've changed I get novels from people, and they say they're the sweetest messages. Dr. Tyna, you've changed my life, or literally you've saved my life. I was afraid of GLP-1s. I was not the type to microdose. I was the type to standard dose because I had, considerable weight to lose, or I had considerable metabolic dysfunction. And my doctor had been trying to get me to utilize these, and I was scared to, but then I listened to your content and I decided it was worth trying. And my life has been forever changed. And then they say this, and they say, and now after the 30 or 45 pounds has been lost or more, they say, now I'm going to start strength training. And I'm like, oh no, why did you wait? Like that was the first thing you were supposed to do. Like, no. And let's talk about why, because now they've crashed out their gut and they've crashed out their metabolism, because that's the engine of the metabolism. So I think we're looking at a big mess coming down the pipeline. Honestly.
Yeah, well, honestly, when GLP-1s, like any sort of weight loss, be it extreme dieting, caloric restriction, will usually result in suppression of your thyroid. It's just a survival mechanism. Calories in aren't enough, then the body reacts by saying, all right, we're going into preservation mode. So we'll slow down the thyroid, we'll slow down our metabolism, and make it harder for you to lose weight, because in evolutionary times, hanging on to weight was actually a survival advantage. That's why it's so damn easy to store it now, because it was advantageous and what's got us here. We have the opposite problem now, and all of our biology is kind of set up for the other way, that if you start tanking your calories, your thyroid will slow down. You do not want a slow thyroid if you want to be healthy, have energy, keep your hair, feel vibrant, have your brain functioning properly. So I guess that's the easy second part to go down from the side effects of GLP-1 dosing, and all weight loss for that matter, is supporting your thyroid, making sure your iodine levels are good, making sure you got selenium, and L-tyrosine is an amazing amino acid that you need to make sure you have. It's one of the building blocks. But the other part to it, and tying in with gut permeability issues and SIBO, is iron. Iron is so essential for thyroid function. And if you have leaky gut, if you've got damage to your gut, IBD, then you're not going to be absorbing iron well, which unfortunately contributes to this negative downward spiral of increased gut inflammation, because unabsorbed iron hanging around in your gut, too much of it can cause even bleeding if you're supplementing the wrong form of iron at too high of a dose. So iron is something that I've looked into so much recently, and I'm becoming fascinated. It's like an easy version of TRT and GLP-1s, in that a little bit's good, the right amount's hard to actually get, and then too much is going to cause damage. It's one of these nuanced things, but you can get infusions. My personal preference for helping people restore their iron levels is the combination of desiccated blood in capsules. Don't just drink desiccated blood. That would be disgusting and very vampiric. And lactoferrin. Lactoferrin is from colostrum, and it binds iron in your gut and helps it absorb into the body. So lactoferrin is becoming one of my new favorite ingredients. I don't have it with LVLUP yet, but I'm going to, having got tremendous results from my partner for increasing her iron levels, which dropped down a little bit. And it's lactobacillus is a bacterial species, Plantarum 299, I think is the other bacteria that helps your body absorb non-heme iron too. So I kind of took us down the iron route, and I hope that helps some people dealing with that. But iron is, you're not going to correct your thyroid unless you have, sufficient levels of iron. And in women,
go ahead. I want to add.
You can add now.
I didn't mean to interrupt you. I apologize. What did you say? You said, and in women, what?
And in women, with periods, and it's often an issue with blood loss too. So my partner, I'm speaking from her experience, really struggled after giving birth to get her iron levels back up. That's another factor that drains it. So the poor women, yet again, have a lot more to do for their health, menopause and periods and pregnancies. It's a lot harder being a woman than it is a man to keeping your health right. So,
well, I was going to say with iron, it's tricky because it feeds the bad bugs if you're taking it orally, right? And so really getting with somebody who knows what they're doing is important on that one, because if your iron infusions, I have used them definitely. I mean, I used to provide them in my office. They can change the game, but man, if the person isn't doing all the things really to optimize their health, it's just a never-ending cycle of these iron infusions, which is really dangerous and oxidative to the body. And then on top of it, iron orally feeds the bad bugs. So if you've got SIBO and then you've got bugs in there from the slowed gastrointestinal motility that are creating a lot of lipopolysaccharides, and that LPS is driving the histamine issue. And so now these people are in a real hot mess, and then we're feeding those bugs with iron, right? So it's tricky. So don't just go pound iron, guys. Like, listen to him. Like the lactoferrin form, I do like the desiccated blood as well. I've used both of those, but man, that's a tricky one, because that's usually when I see somebody with chronically, I'm that girl that had the ferritin of like 9 my whole life. That's the one good thing about menopause is like, I'm not totally at menopause yet, but for some reason my cholesterol was always like 140, which is terrible and way too low. And then my ferritin was always in the toilet. At least my ferritin is going up and my cholesterol is going up. And everyone's like, your cholesterol is elevating. I'm like, yeah, to a normal level. I'll take it. But just pounding iron, that's a tough cycle to get out of. And it usually requires a very holistic approach, which I know you're taking with your partner, and most people are not. So they just think they can take the iron supplements indefinitely. And I'm like, oh, we got to figure out why. Why is the iron low, right? Like one of the reasons you just said, and there's other reasons, but man, but you're so right about the thyroid. I want to go back to the TUDCA too, because it kind of ties this all together. If your liver, I mean, naturopathic medicine 101 is gut first, treat the liver as well. You have some great liver products, and you've got the TUDCA, and you've got the TUDCA with ox bile. If the liver's not working and the gut's not working, I think of them as like BFFs. The gallbladder's certainly not working. And that is one of the real concerns with GLP-1s that I have, is the concern about gallstones and the gallstone potentially lodging itself into the pancreas and ending up with pancreatitis, which is just a complete nightmare. That's a death sentence. That's terrible. It's either terrible pain or death. And so that is one of the biliary issues with GLP-1s are real. I've said that from the beginning. And so we need a happy, healthy liver with motility. And it's running. The ship's running, and we need a gut that's working before we start throwing GLP-1s at somebody, because those two things will definitely impact the gallbladder. And then that ox bile in your TUDCA, I know you have TUDCA alone, and then you have the TUDCA with ox bile. That ox bile in there is going to be so helpful for that gallbladder. And then, of course, the way we choose to eat when we're on these. But all of that to say, I mean, that's just right there. And then having a GI product like your Ultimate GI, they're like all BFFs. I tell people, like, I treat the gut by treating the liver. I treat the liver by treating the gut. It all goes together. And that will all significantly impact your hormones at the end of the day. So thyroid included.
A really interesting tidbit about TUDCA is it indirectly increases your own GLP-1 production anyway. So like you're taking GLP-1s, you're not eating as much. And often as a behavioral thing, when people want to lose weight, they go back to the old school thinking and like, all right, I'm going to count my calories as well. I'm going to avoid eating fats. And without the fat in the diet to trigger the bile release to absorb the fat, that's where you get the bile stasis and the gallbladder issues and potentially the stones too. So that is really important, even if you're doing lower calories, to make sure you're eating good, healthy fats too. You need the bile. It's going to make them work better. The bile is going to help reduce the chances or minimize the issues with SIBO, and then help you absorb the vitamins that are in the fat soluble vitamins in the food that you are eating as well. So fat is so beneficial for health. And back to the iron point too, like, here's a hypothetical situation. Again, you're in a GLP-1, your energy is dropping because of the SIBO. So, and you have low iron. So you start pounding an iron supplement, which increases the bad bugs and increases LPS, lipopolysaccharide, from the bugs. Well, that's now going to have an effect on your liver and your bile. So you're in another sort of side negative spiral that you can get into with that. It can completely crash your health, even though you're going into taking these products, these drugs, with really good intention. I think we need to commend people for trying to do something to improve their self. And that's why I really applaud your approach to it. It's understanding the end goal is what we need to focus on. How they're doing it, we can live with, provided we're intelligent enough with how we support them in that. Like, you and I both know we don't need a GLP-1 to lose weight. We know how to do it with naturopathic ingredients, with our diet, our lifestyle. There's plenty of thermogenics. There's so many other pathways you can target, but none of them really touch the side comparative to taking GLP-1 medication. They're just that powerful because they are drugs. So yeah, that's TUDCA. Supporting the liver too is going to be really helpful too, for the hormone clearance that it needs to occur naturally, but also any other drugs that you're on. It's all cleared through your liver. And if LPS is overburdening your liver, then that's problematic in and of itself. And yeah,
well, and LPS will drive. This is the crazy part. That let me back up before I get into that. I do want to say that I have several people in my family who struggle with obesity, like the real version of like the disease of obesity. And GLP-1s are such a tremendous tool. My issue with them is I know too many people on them who use them as just monotherapy. And I know too many doctors that are unfortunately don't know what we know, and they're just using them as monotherapy. And that's where these problems, I believe, start to arise, is because people get on them and they have to take ever increasing doses to maintain the same amount of weight loss. And they have to keep going higher and higher and higher in order to maintain the same amount of weight loss. And now there's studies being done looking at crazy high doses of some of these because people are plateauing, and that's a real problem. So taking it, I mean, we're just touching on it here, and this is the tip of the iceberg, but just understanding that there's a lot more to physiology than just driving one pathway super hard. Any pathway you drive, like you were saying with TRT, like you cannot just supercharge one pathway and hope for good things to come from it. So, but I will say, like, sometimes that leg up, right? People just need that leg up, and they have such a phenomenal anti-inflammatory effect on the joints and the brain, and we have studies on this, and people feel so much better on them very often. And they're like, oh my God, my lights turned on. I feel like exercising again. I feel like moving. So I think they're such a phenomenal tool to really get that needle moving. But if you really are using them for obesity or weight loss, this is why I'm such a proponent of keeping the dose as low as humanly possible and going as slow as possible, so we have time to implement some of these other strategies and really this is what I'm trying to work through in my course, is getting people to understand at least the very basics so that they can go into this and know, like, it's not just about cranking a peptide or a medication and hoping that good things will come. But on the LPS, here's the crazy thing about lipopolysaccharides. They drive pain. And so I've heard from many people, everybody thinks they're microdosing, but again, very few people are. So 99% of you who think you're on a microdose, you're not. You're probably on a standard dose. But they think they're microdosing, and they say it was phenomenal for my pain, but now my pain's coming back, and it's coming back with a vengeance. And it makes me immediately go to the gut and, like, how much LPS are they producing and what's going on there? Because the bad bugs produce these toxins, and these toxins will drive pain. And it's a whole thing it does with your central nervous system. And so it's kind of sucky. It happened to me too. Like, my SIBO flared, and it wasn't just because of the GLP-1, because I wasn't actually even on a GLP-1 when my SIBO flared. It was stress. But my SIBO flared, and my pain goes through the roof when my SIBO flares. And it's like the first thing that happens. And I was like, damn it. This is such an unfortunate thing for so many people who are probably using these with having such great impacts on some pretty seriously painful conditions, because I came out and was talking about it years ago, and now they're back into the pain cycle. And I'm wondering in those cases if it isn't their gut health. Anyway, that's my side thought. What do you think?
Yeah, definitely. And the LPS drives inflammation, and then it drives the insulin resistance too, which, let's not even consider the thyroid, which we need to for weight loss. But the insulin resistance is probably the primary driver of why they got obese in the first place and would be taking the medication. So yeah, LPS is a huge issue and definitely something. It's why every naturopath who's worth seeing always addresses the gut. And I think everyone needs to at least 2 to 3 times a year, maybe once or twice, if you're doing all the things right, do some sort of gut repair. Even if you think you're doing everything perfectly, it really pays to bring it in, because I have unlimited supply of gut repair. I'm a naturopath. I eat really well, but stress is just something that's unavoidable in life. You and I have spoken offline about all the stresses we've been through. Well, that's going to directly wreak havoc on your gut health too. It really sucks, but it is what it is. That's life. So understanding our life situations and then supplementing or doing protocols to sort of counteract the life we choose or don't choose to live is just how we get through this life healthy, which if you don't do those things, I really strongly believe those who don't are going to have a decreased lifespan. It just makes mechanistic sense to me. Like, how can you just go through all these things and not have one of these chronic diseases come up and shorten your life if you're not proactive about it?
Yeah.
Yeah.
Before we move on, I want to just summarize. So when someone's going on a GLP-1, I love TUDCA. I love ox bile. I love the ultimate GI repair. I love those just hands down. And those are I would say with the TUDCA and with the ox bile in it or not. But those are kind of ongoing usually. And I tend to dose very low because I am conservative and I don't want to drive somebody's liver that's super toxic into overdrive. And this is not treatment advice. This is just how I do it clinically. I'm just conservative with everything. And then I love the ultimate GI repair because I have personally found, and the way that I use it, and I'd love to hear your thoughts. I don't keep people on it indefinitely. I tend to do it for a round. I'll do a round of it. And that round could be like 10 days, 15 days, 30 days. But I love that you can come back to it. Like usually I'll have a bottle for quite a while because it takes me a few rounds to get through it, but it's such a great, like I literally just pulled it out the other day, Kyal. I'm packing, I'm purging right now, and I'm about to leave in a few days. I'm getting in the truck and leaving and driving to Arizona with my dogs. And I'm so freaking stressed out. And it was like, you were like a little fairy. You had sent me all of this level up stuff and I had set it all in this bin, and I get downstairs and I was having a day of it. I was like crying one minute because I'm leaving my family, right? I'm crying one minute, I'm excited the next minute. And I get down there and my gut's a freaking wreck. I haven't pooped in 3 days at this point. I never get constipated. And I'm like, what the heck is going on? Like, this is clearly stress. And I get down there and like, there's the goodies. There's the level up goodies. And I was so happy and took them everything regulated within 24 hours. I was so happy, but I was like, there's my TUDCA, there's my ultimate GI repair. Perfect. Game on. So I use these even without, I'm not on a GLP-1 currently. I use these anyway. So I just wanted to share that before we move on. Do you have anything else about the gut and the liver and that whole complex before we get to muscle and thermogenics?
Not really. We can move on to muscle wastage. I'm pretty sure that's the second most common thing that happens. And it all feeds into, we can't ever leave our conversation when we're talking and staying true to holism of naturopathy and naturopathic medicine. So yeah, I'm glad they managed to help. I think it just goes to show how quickly some of these interventions can work when you're doing all the things. Like it's just a quick, all right, course correction or a very subtle, maybe 1 to 2 days of dosing things that are really powerful is all that you really need if you've got yourself optimized, versus someone who's lived a life and continues to live a life of stress and poor choices. It takes a lot longer. So yeah, thanks for letting me know. I'll happily be a supplement fairy or supplement Santa if I want to be a bit more masculine about it.
It was like a little nest of goodies that I found in the corner because I get so much stuff sent to me. So sometimes I just rifle it all downstairs into my studio and I'm like going through all this, slugging through, going through your supplements and like smelling what's expired. What do you got to throw out? I can imagine you probably have like a closet full of supplements like I do. So it was a lot that was like, took a whole day to pack my supplements and I found them and I was like, yes, Kyal delivers. That's great.
I got about a 4 to 1 ratio of supplements to food in our pantry. It's a bit ridiculous.
Yes. Yes, you
Anyway,
understand. So,
back to the
okay. So, yeah.
point at hand. Caloric restriction, GLP-1s, inducing caloric restriction and reduced appetite can cause rapid muscle mass loss, especially dosed at the wrong dose, as we've established. But even if you're doing it right, making sure that you are exercising when you're taking a GLP-1 to counteract that AMPK, mTOR, IGF, they kind of like swing with each other. And if you're only doing one and not the other, you are going to lose muscle almost not as quickly, but you will lose muscle concurrently when you're losing fat. And that's not a good thing for anything, because we mentioned insulin, all the LPS driving, inflammation driving, insulin resistance, and insulin resistance being the reason you gain the weight in the first place because of dietary choices. Well, insulin is triggered when you eat carbs, and it's meant to dispose of that sugar into muscle. That's like the best place for it to go, because then it's used. But if you don't have the muscle, then it's just going to be more likely to be stored in, and you end up with a rebound weight gain too if you've lost muscle too. So muscle is an organ that we need to preserve, and anyone on a GLP-1 really needs to improve their exercise if it's not existent, or maintain it if it already is existent too. And don't just get complacent because you're losing the weight without having to exercise. They need to be done concurrently.
So, I touched on, and I think this is important because I, as a woman who has always ran very thin, and I had a long history of eating disorders, I touched on this before in the conversation. I want to bring it back. When people go on a GLP-1 at whatever dose, they always want weight loss. That's the other the comment I get. I get people who are actually truly microdosing, truly, sometimes the tiniest little dose. I wouldn't even ever consider that dose that low. And they say, I'm not losing any weight. What's wrong? And I'm like, well, no, it's dose dependent. If you really want to lose weight, you got to go up. Now, I have to go up on GLP-1s into side effects if I want to lose weight. It is not a weight loss tool for me. So while it got the initial sort of inflammatory puff off of me that was happening in middle age from chronic stress and from perimenopause, if I want six-pack abs, that is not a GLP-1 problem to solve, right? That is not going to happen. So I have to bring on other So I say this because I think people are literally dosing and starving themselves into this idea that they're going to get the body that they want, not realizing that the body that they want is actually a body composition of someone who regularly exercises, whether they're doing Pilates or bar or squats and deadlifts. They're still even these skinny models are still exercising very regularly. Those girls on the Victoria's Secret catwalk are definitely doing a lot of exercise. It's just different than what maybe I'm doing over in the gym with my kettlebells and my barbells. But that said, you cannot starve yourself into a perfect body, but they do, and they want the dose higher so they can get lower. And now they've end up just totally emaciated, and it's a disaster nightmare. And they all look like we did in the 90s, which was like we were all starving ourselves to death. So like we looked like a bunch of little heroin chic skeletons. It's not good. I just went through all my photos. I was like, God, my friends and I were skinny. But all that to say is we have other tools, right? We've got thermogenics, and we've got other tools that can help sort of balance that body composition in a more favorable way. So if I want to lose the belly fat, we've got like 5-amino-1-MQ. We've got some other things that might help do that for us. So I want you to talk about that, because I think that's the problem people are getting into.
Yeah, there's heaps of different mechanisms that you should approach when you're looking to lose weight. Like I'm using N-acetyl-L-carnitine, for example, is a very well-known one. Every single fat burner you'll find at a supplement store like GNC or Vitamin Shop should have L-carnitine or N-acetyl-L-carnitine in it. There are other ingredients like GBB that you can use, which is the precursor to L-carnitine, and these are fantastic for lipolysis and fatty acid oxidation. They are required in the mitochondria to burn fat. So if you have deficiencies in those, you're going to be, not burning fat particularly well. 5-amino-1-MQ is a small molecule that is very interesting, and I've been using it for a while. I didn't originally use it for the purposes of weight loss, but it kind of came about anyway. And, a lot of people were using it for weight loss, but I used it for increasing NAD levels. Its mechanistic way that it works is by inhibiting NNMT, which is the main enzyme that actually clears NAD out of your body into nicotinic acid. So the 5-amino-1-MQ inhibits that enzyme's function and basically preserves your NAD levels. And when NAD is cleared out of your body, it also requires methyl groups and SAMe to clear it out. So a little side tangent is completely irrelevant to our point, but I really want to bring this up, is when people are taking NAD therapy, they're doing infusions or NAD injections or really heavily loading up on NMN or NR for the purposes of increasing NAD, they never think about the back end of it. And if you've got a huge amount of NAD pulled, then you're also going to have an equally high amount of it clearing out through this NNMT enzyme, which is going to strip your methyl groups and reduce your SAMe and actually, via like a few different mechanisms, make fat loss even harder. So
Oh no.
that is a
Yeah.
potential biohacking trend that in long term I foresee potentially being a problem. So yeah,
Yeah.
that's where the 5-amino 1-MQ comes in. There's other ingredients. You can actually supplement, I've forgotten the name of it, but it is the byproduct, the breakdown byproduct of NAD. If you supplement it on the back end, then your body is kind of tricked into thinking that it doesn't need to break down NAD or that your NAD levels are fine. I'll try and remember the name of it as we continue to talk. But 5-amino 1-MQ stops that enzyme from clearing NAD and brings it back into the salvage pathway and maintains your NAD levels. So that's why that peptide's really good. And there's another one called JBSNF 000088. Really terrible name for a peptide. No one's expected to remember it. I had to think pretty hard to remember what it's called. But that one also inhibits that enzyme too. And yeah, there's other ways as well, like thyroid's obviously important. We mentioned that earlier to support fat loss. People take green tea extract. That's an amazing activator of AMPK. There's exercise mimetics like L-beta, which is a really cool new ingredient that's been gaining some attention in the fat burning space for a while. But L-beta increases estrogen receptor alpha agonism. So it's a really weird mechanism that I didn't actually think initially when I heard about it would be beneficial for weight loss. But by triggering this estrogen receptor alpha, that's what occurs when you've exercised. So you can trigger some of the same pathways as exercise induced with some ingredients. Like another one that's quite trending at the moment that I'm a little hesitant to talk about because it has some potential side effects, but it's called SLUPP332. This is another small molecule. It's not a peptide, but it's clumped into them. This works via that estrogen receptor alpha agonism, and they call it exercise in a pill. And yeah, that's meant to help with weight loss as well. But I'm not going to talk about that too much because it's, a research chemical and compliance purposes. I don't want to talk about it. All I'll say is
let's not get into that.
We do have it in a microdose because it's a very safe level, but people are really pushing how much you can use, mainly in the bodybuilding space, because bodybuilders and people on GLP-1s kind of have the same goal of I want to lose as much fat as possible. And the bodybuilders don't really care if they die in the process, it seems sometimes, which is unfortunately happening quite a lot.
That's true. Talk to me about your longevity product, because I love that product so much, because you've got the 5-amino 1-MQ in there. You've got the epitalin, which is like all over the internet right now. It's got the NMN. Like this is just kind of your NAD product. And I prefer it over everything I've tried. And I get a lot of NAD products sent my way. I love this product. It gives me a kick. Like that's what I take when I need a kick, when I like need to spark. And there's so many good ingredients in there. I think you just covered most of them, but that's one of my favorites for sure.
Yeah, well, reasons why you'd want high NAD is it's associated with longevity. It helps with DNA repair, mitochondrial biogenesis, and reduction of inflammation. All four of those things, awesome. Like that's why people are so hype about injecting it and taking as much as possible. But the nuance is that NNMT enzyme needs to be inhibited a little bit if you're going to push it really high. Everything in nature has a balance and a sweet spot, and NAD, even though it is amazing, is no exception to that. The ingredient, I just remembered what it's called. It's 1-methyl nicotinic acid, or 1-MNA. We don't sell that, but that is what NAD breaks down to and is cleared to. So if you supplement that, you can increase your NAD levels. Or if you're taking NAD injections, rather than inhibiting the enzyme with 5-amino, you also should concurrently support methylation. That's one way to make sure you're not getting the negative side effects of it with SAMe or B6, 9, and 12. They're all going to be really helpful too.
100%.
yeah, the other ingredients in that product that really allow it to work well are apigenin and fisetin and quercetin. And these inhibit an enzyme called CD38 or NADAs. That's an enzyme that breaks down NAD as well. So we target the two enzymes that clear it, and then provide the precursors with the NMN and the NR that most people would know about if they've looked into this topic.
Yeah, that's a great product. Your point about the methyl donors is, I was taking NAD. I don't love NAD IVs at all. And because again, I don't love driving a pathway that people's bodies aren't prepared to handle. I just don't love cranking any pathways hard because it never ends well. And I don't love biohacking because people end up in a whole pickle of a mess. And then they end up in my messages telling me about it. And I'm like, dude, I don't know what you're doing. But the NAD sub-Q injections I was taking, and I felt phenomenal at first, as I always do. I couldn't remember why I hadn't done it in years. I hadn't taken any in years. And I was like, why did I quit, intermittently doing NAD injections? And then I remembered as I was doing them, I hit the frickin' wall about 3 weeks in. I was like, slam. And I reached for my methylated B12. Of course, I injected that too, that makes me feel like $1 million, but you can't do that forever either. So my point of this whole story is you cannot take things in isolation and drive pathways hard. It's easier when you're younger. It used to work for me much better when I was in my 20s and 30s and early 40s. But now that I'm in my 50s, my body very quickly puts on the brakes, because if you don't have the cofactors or you don't have the whole thing together, and that's what you do so beautifully in all of your formulations, is you are so thoughtful about all of these details. And you I remember the first time, and I said this on the last podcast, I got a bottle of that Ultimate GI Repair, and I was like, this is freaking brilliant. Like, who did this? I thought it was good. I saw your name and I thought you're going to be some old Scandinavian guy. You're just this young, brilliant guy. And I was like, that's genius. Get him on the podcast. So yeah, love it. Love the thought you put into these. You have another product that I really like, is the Total Recomp, but I don't understand how that one works. So can you talk about that? Because I think that ties into this conversation.
I basically got in this mode of a whole week of putting my headphones in and trying to think of every single mechanism for weight loss. I had made this product because I mentioned on the last podcast, I lived in mold, had a bit of leptin resistance, and gained a little bit around the trunk and wanted to get rid of it. So I'm like, all right, I'm just going to I don't actually care how much it costs or what goes in it. I'm going to support every single one of the pathways of weight loss. So I use peptides that increase neuropeptide Y. There's one called DNF10. I used all of the thermogenics I could. I added things to support thyroid, some appetite suppressants, those exercise mimetics that I spoke about before, and then a big emphasis on blood sugar stabilization and glucose disposal with ingredients like berberine, but not regular berberine, which doesn't absorb well. Interestingly, back to SIBO, berberine's a good one to take as well. It's going to give you that two mechanisms of action, help with the SIBO and help with your blood sugar. But dihydroberberine is about 40 times more absorbable than regular berberine. So that's going to work better for, systemic glucose control and not really come with the nausea or the side effects that some people get from regular berberine. So that's why I made that product, because I got a little fat myself and didn't like that.
Well, I love it. It's a great one. And it again, if you're chasing a certain body composition, you guys, and you think GLP-1s are the answer, they're usually not. They're at the doses needed to really start that ramp up. If you're not training, you are going to be wasting. And so having other ingredients on board to help you, whether it's peptides or, nutraceuticals or whatever, a lot of the things that are in these formulas, or wherever you're doing your research, you have to consider different mechanisms of action, because you can't just waste away on GLP-1s and hope you're going to end up looking like so-and-so that's doing it. So anyway.
To stop the wasting away, we need to not focus on the fat burning one, but things to preserve muscle mass, which would be your essential amino acids, your weights training, creatine. They're going to be your foundational things that I think everyone on GLP-1s, even if everyone should be taking those. That'd be really supportive to your body. Other things you can take to preserve muscle mass would be peptides like BPC-157 and TB500. TB500 needs to be injected, but you can take oral fragments of TB4, which we have in our product Wolverine, which will just preserve the muscle mass, that do its best job in preserving the muscle mass and helping with recovery if you are doing the gym training, which you should be doing when you're on GLP-1s. So they're that Wolverine combinations. I made it for people who have injuries and are trying to recover from injuries, but it does have, BPC has an effect on up-regulating growth hormone receptor density, which means that, anyone who's doing any training, growth hormone is going to work a lot better and you're going to recover faster and preserve your muscle a lot better from that one. And TB4 fragments also have an effect on actin, which is one of the main proteins in muscle fiber, and it helps preserve actin too, so you're less likely to break down your muscle fibers from the GLP-1s, or even if you've had a surgery or something or an injury and you're immobile too, it'll concurrently help you heal faster but preserve the muscle mass from that as well. So that's why I made that formula.
That's a brilliant product. I do not have that one in my stock yet, but I saw it on your website and I was like, oh, you put them together. That's what I tell people to take to heal. I would love your thoughts though. I don't love people being on those indefinitely. I think that cycling them is a preferred way of doing it. What do you think?
Yeah, well, all peptides for that matter work on a receptor, be it on the surface or intracellular. They work on receptors. And anything with a receptor, caffeine has receptors, adenosine receptors, which it acts on. Anytime you're hitting a receptor for a prolonged period of time, you're going to end up with downregulation of that receptor. It's not like 100% proven fact, but I just always err on the side of caution and don't want the products to stop being as effective. So for every 2 months on a product, I always recommend take a month off, let those receptors, give those receptors a break. Don't let them downregulate, and usually the product will work a lot better if you do it less, but in a strategic manner than if you're just doing it all the time. Plus, naturopathically, I hate people being on things all the time. There's a time and a place to be on something all the time. If you have a disease or an autoimmune disease or something like that, and you're constantly fighting with, then yeah, you need to be on things for a long term. But I have 40 products almost now, and I'm currently on 3 of them because I've got my health to a state that I only bring them in when I need to. So it's a crap business model, but that's how I really want Level Up to be. It's all right, you've got the tool. It's like a medicine cabinet thing. You bring it in, and then it should restore the body to the point where it doesn't need it for a while or ever. That's hopefully where we'll get to with the world, with the food chain, with stress levels, that you can just only bring these things in as needed.
I totally agree with you. That's exactly how I do it. Because people say sometimes, oh, the cost. And I'm like, look, you're going to use this intermittently. You're going to have this bottle for a good long time. This is not a get on it and stay on it forever kind of thing. And I don't really love people being on some of these peptides forever because inherently a lot of them are pro-grow. And, what are they growing? And I know we don't have any links to cancer, but I also know that when we're doing, and my background's regenerative medicine, right? Like I'm careful with what I apply because we are trying to regenerate tissues in an orchestrated fashion, not sort of, slop on peptides and cross your fingers and hope for the best and continue to live a shitty lifestyle.
I will bring up something I know people will probably ask in the comments, and it's something our customer support and social media gets asked all the time is, doesn't BPC cause cancer?
No.
I hate that question because no, it doesn't.
No.
Angiogenesis is one of the pathways that BPC upregulates. VEGF, angiogenesis, new blood vessel formation. That's fantastic for injury recovery, for regeneration. Oxygen to the tissue, and then waste removal is only going to help the process. However, cancer utilizes angiogenesis. Angiogenesis is one of its hallmarks of growth. It's not to say that that's the cause of it. It will just be utilized. So if someone has cancer, I'm like, yeah, be careful with BPC, probably don't take it. But also be careful with leucine, be careful with branched chain amino acids. All these, there's so many different pathways that, cancer cells utilize for their survival and their growth, that just because one of them is upregulated from this peptide, it doesn't mean it's going to cause it, because, that's just a bit foolish. And if anything, in my opinion, is the reduction in LPS, as we mentioned earlier, that BPC can help with by sealing the gut, is going to knock off like 2 or 3 of the hallmarks of cancer, the pro-inflammatory signaling and, the what do you call it? The foundational things that are a precursor to cancer growth. Getting your gut health in check is going to do so much for preventing it by that reduction in inflammation, that it's just a bit ridiculous to me to speculate that it could cause it.
Right. Causing and I mean, I'm just careful with these. I'm careful with all of them. I'm careful when I apply them to patients. I'm careful when and I talk about this, and people who aren't really familiar with peptides are like, you're not supposed to be on BPC forever. And I'm like, no, I don't think that's a great idea. But again, we don't have conclusive data. You have a couple products. So your Ultimate GI Repair comes with BPC or BPC free. I have both. You have just BPC straight, but then you have this Regenerate product that has PEA in it. I love PEA. Can you talk about that a little bit? Because this Regenerate BPC 157 product I'll link all these in the show notes, you guys. This one is like, what a great formula. Tell me about this one a little bit.
Yeah, PEA is pretty much my favorite non-peptide ingredient, and it's in so many of our products. It's in our histamine product because it stabilizes mast cells. It's found in breast milk. It's, mothers who are breastfeeding will give PEA to their child or their newborn, and it's an analgesic and a pain reliever and an anti-inflammatory. So I speculate, can't confirm this, but I speculate part of the reason why when babies hurt themselves, they want the boob is to get a little bit of PEA because it might be helping with their pain relief. But PEA to me is pretty much the best anti-inflammatory. I might rank it equal with pro-resolving mediators, but it's one of the best anti-inflammatories. I think better than curcumin because curcumin can, sequester iron and have some issues with iron absorption for those who are low. And I think it's better than fish oil because I just don't trust fish oils anymore in the in the market for them not to be oxidized. There might be some. That's why I tend to prefer the specialized pro-resolving mediators because, it's like, well, if fish oil is a problem or it oxidized, then I just want the mediators out of it rather than the rest of it. But back to PEA, yeah. It's used in dentistry as well as a fantastic analgesic for pain after dental procedures, and it's just works so well at knocking down pain from a natural perspective, whilst the peptide that's in it, the BPC and or whatever other peptide I've combined with the PEA works on the back end and sort of does the hard work in resolving the why that you have the pain. Say you've got an injury, the PEA will on the front end give you the pain relief and help with the inflammation, while the peptide works on all the growth factors and accelerating the healing process. So that product is awesome for connective tissue injuries and helping with injury recovery.
Oh, as part of the collection of products that you sent me a bottle of PEA, and I had ran out, and I had forgotten that I'd ran out because I take so many supplements, and I have like a chronic spinal issue, and it was really flaring because I had been moving boxes that were a little bit too big for me to be moving, and just that constant like rotation, pick up and put down, for all day long. And I found that bottle of PEA and I was like, oh, thank God. I freaking love PEA. I use it topically too. I smear it on, I take it orally. Like I am a huge PEA fan. So I was excited to see that in there, and I wanted to hear your take on it because I think and you're right with that histamine issue. You have a histamine product, but PEA is so good for histamine as well. And then we would be remiss not to mention KPV when we're talking about gut health and inflammation and all of this, and just inflammation throughout the body. I think KPV is a really beautiful peptide for all of that too. And you guys have that in your line.
Yeah, it's essentially the anti-mold peptide is what I describe it as in one sentence. But the anti-mold, it's part of the Ritchie Shoemaker protocol for increasing alpha MSH. So that's why I love it for, mold injury and SIRS, not mold injury, mold exposure and SIRS. But it also is a really potent anti-inflammatory. It works on the gut to reduce the interleukin-6 and TNF-alpha, which are some of the inflammatory cytokines that drive gut inflammation and permeability. So that's why we include it in that one and have it as a standalone.
Yeah, it's in your Ultimate GI Repair, isn't it?
Yep.
Also,
so GI Repair, basically, if you're on a GLP-1, is going to be covering so many of the bases. The BPC's in it that could help preserve the muscle mass whilst it's sealing up the gut to reduce the LPS that's going to cause the liver issues and, help and potentially cause issues with insulin signaling and inflammation. So that's, I think, why we wanted to chat, is to make people aware that one can really be a one product to help. I mean, I guess combined with TUDCA, you're hitting all bases with those two.
Totally. I was going to say, if I were to pick like my top two, it would be the Ultimate GI Repair and then add your TUDCA, I think. And then you have the TUDCA with Oxbile if people need that. And I do think that people on a GLP-1 could benefit from Oxbile. I love the total recomp if people are looking for body composition changes. And I love the longevity for all the reasons you said. But that 5-amino-1-MQ just kind of has that thermogenic effect as well. So that's a really nice bundle. But if I were to just pick one, it would be the Ultimate GI Repair with the BPC in it. It's a beautiful product. You did a good job. You do good work, Kyal. you have the brain. You're like a mad scientist with a cool accent.
I'll take it. I've been called a wizard before, and that one was quite fun. So,
mad scientist is good too. All right, so I think we should wrap it up with that, not to confuse people. I know we've provided them with a lot of information, but hopefully we summarized it well at the end. You guys are offering a really nice discount to my followers, 15% off everything. If you use code Dr. Tyna, that's DRTYNA. You can go to leveluphealth.com/Dr. Tyna, and I'll have the link in the show notes. It's LVLUPhealth.com/Dr. Tyna. Use code Dr. Tyna at checkout, and that'll give you a nice discount. I think that for folks who are on the GLP-1 journey, like I said, inside my course, I cover hormones, I cover metabolic health, I cover strength training, I cover all of that in really deep detail. But I think ultimately for just the average person out there who's utilizing a GLP-1, support your gut, make sure that you understand what you're going for if you are going for body composition changes, protect your muscle, don't get your gastrointestinal tract, your biliary system, and your liver in a pickle because you are not taking care of what you're doing, because it is a very potent medication and peptide at the end of the day. So yeah. Anything else, Kyal, you want to add?
No, I just hope we didn't confuse them. If they're confused and need some further education, I can't vouch highly enough for your education, and they should definitely check that out. And if they find that one of the products are a useful tool in their GLP-1 journey or any other journey that they have, then I really hope you'll let me know how they help. I don't really tend to hear too much of the feedback on the formulating and business end. You kind of miss being in the trenches as a practitioner, sort of working with people and seeing how the products or the protocols go. So yeah, just let me know, send me a DM or something.
I will for sure. And we'll have you back again, and we'll talk more about this, because I know this is a longer story. So anyway, so fun. Thanks for coming on the show today, and we'll talk to you later.
Thanks, Tina. Thanks, everyone.
Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guild. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.